What are the possible approaches to improve drug development success in heart failure?
Well, obviously you can come up with new novel targets, and of course there's a lot of effort underway for that. I think a more likely, quicker method, though, is to identify subpopulations of patients who respond very well to a certain kind of therapy versus another. You can theoretically do that genetically. That's called pharmacogenetics, and there's work underway to do that. And I think, in heart failure, it's been shown that you can improve the biology of the failing heart, and that involves altering gene expression in a favorable way. And clearly there are gene networks that are triggered in heart failure that are then reversed partially by some treatments, and we can potentially come up with specific treatments that more favorably affect gene expression. So those are the big ones.
What are the potential advantages of pharmacogenetic drug development?
Yes, number one, you identify a more responsive subpopulation, so you have a better chance of winning in a clinical trial, particularly against a placebo. The other thing is that when you have a pharmacogenetic drug development, essentially you can file patents on the pharmacogenetic data, which occurs later in development, and those patents actually are valid and will hold, and so you have a longer time to essentially market your drug commercially. So your exclusivity period goes up typically by 10 more years. And so that, from a commercial standpoint, for a drug developer, that's a real advantage.
So in conclusion, is cardiovascular drug development dead, or is it only sick?
It's in a brief hibernation period. So hibernation isn't sick, it's just asleep for a while. It's going to take off again, we think. So it's going to wake up.